When someone needs immediate medical attention, but the nearest trauma center is several counties away, medical helicopters are used to transport the patient quickly.
On a bright sunny day in the middle of rural western North Carolina, an accident has happened. There are reports of injuries, with some being serious.
They have a critical patient that they need to get to a trauma center in Winston-Salem, or in other cases, it may be a trauma center that's closer to them that we can fly them to.
That's where these men and women come in to help.
Well, certainly anyone that is a great distance from a trauma center, anyone that has been pinned inside of a car where that extrication is going to take quite a while, and then they would still have a journey down the road that may take 30 minutes or more. Helicopter can be there much quicker.
Lisa Harris is one of the flight nurses that are found on board one of these flying ambulances. It's her job to help you survive the trip, getting on the helicopter all the way to the hospital.
And there is always an unknown. No matter how well you're prepared, there's always something you aren't prepared for.
On her side always is a flight paramedic, like Justin Bowers.
As a flight paramedic, compliment the flight nurse. She usually, or he usually, the flight nurse has experience in a ED or emergency department setting or ICU setting, and so bringing that expertise into the chopper with a flight paramedic who has an extensive background in working in the field, and usually either by himself with another EMT or another paramedic, we kind of complement each other.
It's a community effort. It's not just us here isolated, dropping in on these areas. They're glad to have us here. They appreciate that we respond to their calls for help. There are many places that you cannot access in a straight line. It may take many, many minutes, sometimes more than that, just to get to a patient, whereas by air we can get there quicker.
The team could not land or take off in the field without the expertise of the emergency members on the ground, who were first on the scene.
Our ground crews, whether it be EMS, rescue squad, fire departments, first responders, we work closely with them through LZ communication classes and opportunities for them to kind of show and tell the helicopter. And we have a really good working relationship with those folks who know kind of what we need to happen prior to our landing, so they take a lot of that work off of us.
These air transport heroes are not alone in their battle. The pilots are just as much a part of this team as the medical experts on board. Each trip, the crew of 3 must pack themselves tightly into the workspace while leaving room for the patient and equipment that's needed to help them get to the hospital.
What you see is pretty much our work area. Our patient is usually further back, about this area right here. So basically within an arm's reach of where we can access or where we can get to.
Once the patient is loaded onto the sled, this is our sled, we just slide the mount in and secure it. With the swivel, that makes it easier no matter what size the patient, whether it's pediatric, even up to some of your larger patients.
All of our equipment is within easy access or easy reach, and then our patient, all of our monitoring equipment, anything that we need to attach or to put on the patient prior to, we try to do that when we're packaging the patient prior to loading in the aircraft. It's always been a lifelong dream. So being able to fly in an air medical helicopter based in Elkin, where I was born and raised and grew up, the fun aspect of the job, being able to bring the aviation to something that I've always loved, which is pre-hospital medicine and being a paramedic in general, being able to add that aspect of being able to fly, doing what I always loved to do at about 2,000 feet, it's just an awesome experience.
For Lisa Harris, there are some days that remind her of just how important her job is to the community she serves. Sometimes she even gets to meet with families who've had to take a ride on the helicopter.
This gentleman ended up losing several limbs, but he's alive today because of the helicopter, because of the speed, getting him to where he needed to be. I was able to talk with his family and him on Christmas Day this past year, and it was just wonderful. They were so appreciative, and it just renewed my faith in what we do.
Justin and a team of flight paramedics placed first in the Journal of Emergency Medical Services 2016 Games in the Advanced Clinical competition held in Baltimore at the end of February. All of the members of his team are from the Elkin base, though they work on different shifts.